Hi guys, welcome you all to the Nursing Update YouTube channel. Today we'll see the fourth set of questions in psychiatric nursing. So this will be the last set of questions in psychiatric nursing. From next week onwards, we move on to obstetric and gynecology. So after that, when the rotation comes, means after gynec, then medical surgical, then fundamentals, then community. Okay, then the psychiatry nursing will come. Okay, that time we'll see the rest of the questions. So let's start today's video with the first question. So if you are new to our channel, please subscribe our channel and press the bell icon. Okay, let's start today's video. First MCQ. The most frequent characteristic feature for a patient with bulimia nervosa is. I hope you guys have watched my previous video. I have explained what is bulimia nervosa. Okay, so if a person is there, he or she is suffering from bulimia nervosa, what the clinical feature you can expect? Okay, badly stained teeth, positive body image, previous history of gastritis, regurgitation of food. Okay, the correct answer is badly stained teeth. Okay, so this is one of the most frequent MCQ. Okay, I personally have seen more than 3 or 4 exam papers this question have asked. Okay, the characteristic feature or the key sign in bulimia nervosa is teeth discoloration or teeth staining. Okay, badly stained teeth. Okay, so next MCQ. Which of the following is not a common motor symptom in conversion disorder? What is conversion disorder? So you should know what is conversion disorder, then you can see. Okay, they have some issues with anxiety disorder or with some stress will be there. Okay, they convert that into a physical symptom, that is conversion disorder. Okay, so out of that, which is not seen? The question is negative part. Be clear with this. The question is negative part. Okay, option A paralysis, option B impaired balance, option C urinary retention, and option D double vision. Okay, so the correct answer is double vision. Okay, so this question, in this question you can read a point. The rest all the symptoms are seen in conversion disorder. Okay, what are the things? Paralysis can be seen in conversion disorder, impaired balance can be seen in conversion disorder, and urinary retention can be seen in conversion disorder. In conversion disorder, the patient will exhibit signs and symptoms which are related with the neurology, gastrointestinal system, then this urinary tract, means genitourinary system. Okay, so these are the three most common system where the patient will exhibit the signs and symptoms. Okay, be clear with these 3 points. Okay, so in this the odd man out is double vision. Okay, so coming to the next MCQ. Which of the following nursing intervention is appropriate for client experiencing auditory hallucination? Yes, what is hallucination? Hallucination of many types. Running commentary. Okay, so visual hallucination, auditory hallucination. Okay, some in the absence of stimulus, they are hearing some voices. Okay, that is auditory hallucination. Okay, so let's suppose the patient is on auditory hallucination. What you will do? Ask the patient to describe what the voices are saying. Option B, approach the patient and touch the patient. Option C, encourage the patient to have a good sleep. Option D, acknowledge that the client is hearing voices but make it clear that the nurse doesn't hear these voices. So let us see all the options one by one. Ask the patient to describe what the voices are saying. It's no use. Okay, so if you are asking to describe the voices, they won't tell also. If you are encouraging that, it will become in a negative manner also. So you should not encourage them to say what they are telling. Approach the patient and fetch the patient is of no use. Encourage the patient to have a good sleep, somewhat okay. But the correct answer is acknowledge the client is hearing, acknowledge that the client is hearing the voices, but make it clear that the nurse does not hear these voices. You have to restating. Restating is the one of the most important aspect in nurse-patient relationship or any of the IPR. Okay, you should tell the patient that I am not hearing anything. Whatever you are hearing is doesn't exist in this world. Okay, you are hearing something else which is not in this world. Okay, so you should tell them clearly. Okay, that is the most appropriate intervention for a client experiencing auditory hallucination. Okay, so let's move on to the next MCQ. Woman on lithium therapy is pregnant. Which of the following disorder is seen in fetus? Okay, what is lithium? Lithium is anti-manic drug. Okay, I have explained in previous videos. If you didn't see, I have sent the description in link in the description box. Okay, please check it out. I have told the most important aspect where the MCQs are in abundantly comes in exams is from the therapeutic intervention or treatment modalities in psychiatric nursing. Okay, so among this, first most important is antipsychotic, second most important drug is anti-manic, like lithium. Lithium based questions many are came, therapeutic dose of lithium, what in electrolyte imbalance occurs, and this also came. Okay, if the patient is pregnant and she is taking lithium, there is a chance for teratogenicity. What is teratogenicity? Let me know in comment box what is teratogenicity. Okay, option A, neural tube defect, option B, scalp defect, option C, Epstein anomaly, option D, urogenital anomalies. The right answer is Epstein anomaly. Okay, so it is one of the anomalies related to the cardiovascular system. Okay, this MCQ also have came. Okay, which one of the following disorder is seen in fetus, like that. Okay, as the patient is on lithium therapy, the patient will develop cardiac anomalies. The option might be cardiac anomalies or Epstein anomaly. Okay, so what is Epstein anomaly? We see in medical surgical nursing part. Okay, so let's move on to the next MCQ. Which part of the brain distinguish right from wrong and act as a sensor of behavior? Ego, id, libido, and super ego. Okay, so I hope whoever reading psychiatric will know Sigmund Freud. Yes, Sigmund Freud is one of the his contribution is one of the biggest for psychiatric and mental health, not only nursing, all over psychology. He have given a brief introduction to psychology. Okay, so he has given three terms. The whole human behavior can be summarized into three terms, that is id, ego, and superego. Okay, so you should know what is id, what is ego, what is superego. So what was the question? Which part of the mind distinguishes right from wrong? Okay, they have. So suppose you are in a traffic signal. Okay, so the red light has came. Okay, you should stop the vehicle. Okay, so this behavior comes from which part of the mind? Okay, this is what he is asking. Okay, so it comes from super ego. Okay, so I will explain what is id, what is ego, and what is super ego. What is id? Instincts. Okay, what is ego? Reality. And what is super ego? Morality. Okay, what is id? Remember id as instincts, I and I. Okay, so What is instinct? Suppose if you are feeling hungry, you will eat. Okay, so that is one of the instinct. Okay, that part of the mind is controlled by a term called id. Okay, what is ego? Reality. Okay, what is reality? So you want to, whatever your life is going on, that is being influenced by the ego part of the mind. Okay, what is super ego? Morality. So what is morality? What is right? What is wrong? What should be done? How a person should behave? How a person should dress? How a person to eat? Okay, those morality of ours are taught by us, and that is kept in super ego part of our mind. Okay, that is known as super ego. Okay, so let me give an easy example so that you people will remember this forever. Okay, for example, you are in a examination hall and you are feeling sleepy. Okay, so at that time your mind will tell you, let us sleep. Okay, that part of the mind is known as id. Okay, then your mind will tell, you are in an examination hall, all are writing, so you should not sleep. Okay, that is known as ego part of the mind. Okay, same scenario, for an examination hall, you are feeling sleepy, your mind will tell, you have prepared this many years for this exam. Okay, you should get this much marks. Okay, so you should not sleep at all. Okay, so that is controlled by super ego. Or else, let us take one small simple example. You are on a diet. Okay, you saw a chocolate, your favorite chocolate, whatever it may be. You saw a chocolate and you want to eat that. Okay, you want to eat that chocolate, that is known as eat. Okay, so what is ego? Okay, we are on diet, let us take only one bite of the chocolate, that is known as ego. What is super ego? It will be telling, no, you should not eat at all. Okay, that is known as super ego of the morality. Okay, so I hope you people are so clear. Okay, so our question was, which part of the mind distinguishes from right and wrong and act as a sensor of behavior? Okay, it tells this is right, this is wrong, you should do always do right things. That is told by super ego. Okay, so that's all about today's video. So thank you so much. So if you are new to our nursing update channel, subscribe our channel, and I hope you like our videos. So press the like button and share this video to your friends. Okay, thank you so much guys.